All right, so here we have a 20-year-old college student who presents to the student health clinic with complaints of fatigue and sore throat. On further questioning, she reports that she often eats large amounts of food rapidly, followed by episodes of vomiting to feel better. She says these episodes occur several times a week, usually when she is alone. She expresses distress about her lack of control during these binges and states that she is extremely dissatisfied with her appearance, though her weight is stable. Physical exam reveals a normal BMI of 22.3. She has dental enamel erosions and bilateral parotid gland swelling. Calluses are noted on the dorsum of her hands. Which of the following is the most appropriate first-line treatment? Okay, so if we just run through the question, right? So you're talking about a young person here, 20 years old, right? She reports having sore throat. That's important. She eats a ton of food rapidly, and she has some compensatory behaviors such as vomiting in this patient, right? She does this several times a week, which is also important in your diagnosis. She has difficulty controlling the binges and the vomiting and stuff like that. Her weight is stable and her BMI is normal. There is dental enamel erosion and bilateral parotid gland swelling. And there's also calluses at the back of her hands. Right, so the diagnosis for this is bulimia. First of all, if they give you a question this like clear, or like it's an extra point for you. Okay, so yes, the answer or the diagnosis is bulimia. And if you haven't checked it out already, we already have videos for bulimia and anorexia up already. Okay, so what's going to be the first line treatment for bulimia? That's going to be CBT, right? So cognitive behavioral therapy. So the answer is B. Right. Now, if they ask for the medication, what's the first line medication that you're going to use for bulimia? The answer will be SSRI. So SSRIs are first line treatment in terms of medications. All right, so let's go through the other options. Topiramate. So this is an anti-seizure medication, yeah? But you can sometimes use it for binge eating disorder because of the side effects. And it has a ton of side effects. I would not necessarily advise using this. It's certainly not first line, right? So one of the side effects is it curbs your appetite, and the other side effects would be like mental dulling. It's kind of what it's called, as well as so you're not able to think straight. But then you can also get kidney stones. So it's not really first line for anything. Inpatient hospitalization. So if the patient's BMI was like dangerously low, so like below 16, first of all that would make it anorexia, right? But if it was that low or they had serious electrolyte imbalances, then you can hospitalize them. Olanzapine is an interesting one, right? So it's also not first line. You can use it for anorexia, so it's an antipsychotic, a second generation antipsychotic. You use it probably like second line for anorexia, right? Because you're also trying to use the side effects of it, in that you gain weight if you're on olanzapine, right? So remember clozapine and olanzapine in the second generation antipsychotics, you can actually gain weight from those, right? And then refeeding protocol, that's mostly used for excuse me, anorexic patients. All right, so yeah, thank you.